Hello, everybody, and welcome along to another one of these interviews with me, Ben Calder, for the BTPA, the Bowen Therapist Professional Association here in the UK. And I'm really fortunate enough today to be joined by Graham Pennington, who's in Warrnambool, in just west of Melbourne, in Australia, joining me on Good Friday as we record this. And Graham, I've been a fan of your work for a number of years now. I'm going to fanboy. I've got my copy of your book here, a textbook of Bowen Technique, right with me. And I did my Importance of Symmetry training, my IOS training with Robert Smith in 2021, and it made an incredible difference to the way that I used and approached Bowen. And even this very day, the techniques that I learnt within that training have made a beautiful change to somebody that was struggling in a lot of pain when they came into the clinic today. So I'm really grateful to have an opportunity to have a conversation with you today, and really grateful for your work. So Graham, thanks for joining me.
It's a pleasure, Ben. I'm always excited to talk about Bowen, and it's great to find someone who's also passionate about the sort of Bowen that I do. So thanks for having me.
Yeah, no problem at all. Absolutely my pleasure. So I think for anybody as well who maybe doesn't know your work and hasn't really spent any time looking at the stuff that you do, tell us a little bit about how you got to where you are today. What got you involved in the physical therapy that you do, and what's become Bowen?
Okay, I hope you've got enough time for those sorts of stories, Ben. I was a new naturopathic graduate back in 1989, and I basically fell into a wonderful spot where I got to take over the running of Aussie Wrench's clinic in Hamilton, and he wanted someone to run his practice so he could go and teach full-time this Bowen technique that he'd had the fortune of learning in his time with Tom. So I took over his clinic, and I ran the Bowtech clinic there for 3 years, and was very involved at that stage in the establishment of the process of seeing Bowen become bigger and going onto a world stage. And then I went my own way and started my own practice in Warrnambool. And I've been in practice now, well, you can do the maths on that, it's my 35th year of practice. For me, the challenge was how to get the best clinical results. And for me, it was always a career that I was looking for. I was always in it for the long haul. You know, I was quite a young graduate, so I knew I had 20 or 30 years in the profession ahead of me. So I was looking at it as a long haul approach. And so I introduced lots of other therapists into my own practice. And from a very busy practice with lots of other types of therapists, osteopaths and chiropractors, and I'd become an acupuncturist by that stage. We had a very busy practice, and I finally got to convince Romney Smeaton to let me come and watch him work in his clinic in Geelong. And that was a major game changer for me. I spent a fair bit of time observing Romney, who was someone who'd spent every Monday with Tom for about 6 years. And it's worth noting that Romney also continued to run Tom's clinic when he was ill, and he also continued to run Tom's special clinics for something like 12 years after Tom passed away. So it was great to observe him and see a different spin on the Bowen technique. And then drawing on all these different sources, I guess, I started to create my own approach, which I don't see it as a different approach to Bowen. I see it as what I would think is the approach that was being used in Tom's clinic. And it's very much a focus on the central nervous system and its relationship with the spine. It's very much the same principles that we use when we do Bowen therapy that are involved in osteopathy and chiropractic. We're creating spinal balance through dural release. And so I basically developed an assessment system that would allow us to see what was causing the person's major stresses, or to the nervous system. And then you could assess them, you could see what was causing that, and you could tell that you had corrected that problem with a post-assessment. So So I decided to write a book, a textbook of Bowen Technique, and I put that out there. And that probably would have been it, except I thought that people hadn't quite understood from the book, so I decided to teach. So I just started a couple of workshops to try to teach people who'd bought the book what I was trying to say in the book. And basically the internet carried that information pretty much around the world. And so now I've been able to present my workshops in 26 or 27 different countries. So it's been I think it's really important to say that what I do is I don't teach Bowen Technique. I teach people who have already learned a form of Bowen Technique how to value add the technique that they have.
Yeah, beautiful. That's such a beautiful introduction to the work that you do, and certainly one of the things I find really interesting, one of the things that jumps out at me first of all, and I'm starting to have these conversations with a number of people who've been involved in Bowen for years, and the very fact that your beginning was in something else, was in naturopathy, that along the way you've taken on board other modalities, the acupuncture, and you've looked from a lot of different directions, and it's all those influences that have really informed the work. Because myself, for 21 years now, I've been a kinesiologist, and we work a lot with 5-element and acupuncture theory. And then, coming into Bowen, I also teach Qigong within the work that I do as well. So I find it really interesting, especially for some of the students that are coming in later on down the lines who are coming straight into Bowen and maybe haven't had training in other health modalities, that for those of you who have created such important work in Bowen Technique to help us to bring it to where it is now, that there's been a lot of influences in your career that have helped us shape these viewpoints. So was there anything that really stood out for you that made you go in the direction that you did with the importance of symmetry work?
I would say that the first big step for me was that even in the Hamilton clinic with Aussie, we were always looking to make sure that the patient had equal leg lengths if we could. So we used to see that as a twisted pelvis, so to speak. And if we could do things like the pelvic procedure, we'd have a good chance of straightening that up. It was probably for me when I noticed, or when I realized that wasn't a reflection of a twisted pelvis per se, it was a reflection of nervous system stress, what you might call neuromeningeal stress or tension. And so that could be coming from as far away as the neck or the jaw. And so for me, it made me realize that to balance the body up, I could still use those sort of leg length assessments, but that my treatments might not be anywhere near the pelvis. They could be at the other end, for example. And then I started to quiz friends who were chiropractors and osteopaths to try to get deeper understandings of how they worked. And what I found was most of the major schools of chiropractic and osteopathy were working exactly the same way. And it's really interesting. I was one of the things, and it was Aussie who first said it to me. He's, I said, he asked me one day, how are you going? And I said, it's big shoes to fill. I don't know how I, as a new graduate, will ever reach that level that you're at, with an established practice. And he laughed and he said, I asked Tom the same question. And Tom told me, it's really easy. All you have to do is fix 4 places. And I was like, what? And he said, yeah, if you fix these 4 places, the patient will get better. And I was like, what? It can't be that simple, surely. Yeah, what are the 4 places? And he said, Tom said, you have to fix their neck, their jaw, their sacroiliac joint, and their coccyx. And if you do that, they'll get better. And of course, I asked why, and Aussie didn't really have any answers as to why. He said, that's just what Tom said. But then I always wondered about that. Why? And then for me, probably the greatest epiphany was when I realized that those 4 sites are the sites at which the dura mater attaches. so that all of a sudden, of course, if we fix those 4 sites, we can actually bring balance to the spine as a whole, to the nervous system as a whole. And that's the underlying principles that underpins the big schools of osteopathy and the big schools of chiropractic. Sacro-occipital technique, for example, is exactly about that. And it was exciting because as a Bowen therapist, we had all the tools in our kit already to address imbalances at these places. We just didn't understand that that's what they were doing. And so for me, drawing on that information from the combining, looking at Bowen technique, osteopathy, and chiropractic principles, that gave a very good explanation. But then as soon as I brought in the Chinese medicine ideas, that was like kaboom. I work, it's been a long time now. It's been at least 25 years since I started observing Romney. And even Romney will tell you that the Chinese medicine explanations in terms of the meridians and in terms of the acupuncture points are a wonderful component of explaining the work that Tom Bowen did. And so as I guess my journey now is moving deeper into being able to explain and to shine a light on how that part of the work works. But for me, they're the sources. To me, Bowen is a great synergy between chiropractic and osteopathic principles, and particularly the meridian system of Chinese medicine.
Yeah, fabulous. And I certainly know that the first time that my Qigong teacher showed me images of the fascia sinew channels and their relationship into the 5 elements, and you start to see these whole swathes of parts of the body that link into those channels. It's a really interesting way to observe the body, and that it's a beautiful question again for anybody who's earlier on when I was thinking about how this breadth of experience, all these influences have kind of informed the work that you've been creating, and how there's more students, I think, coming in maybe with not so much background in other areas, and things that maybe they develop as they go along. And certainly within some of the Bowen training that I've had, the discussion of acupoints, meridians, the principles within Chinese medicine that have a relationship into Bowen's work and into the work that we're learning. So for anybody that maybe hasn't looked at that so much, why for you is that important? What is it about? What qualities is that offering into the work that you think are relevant?
Well, I'll go on a limb here. I'll put myself out there. I think that Tom inherited the core of the technique through Ernie Saunders, and had only learned it in a pressure point workshop that was making me believe that the origins of the technique come from some clever people in Japanese acupressure and shiatsu. Romney was given a book about shiatsu by Tom, and Tom said to him, "That's the whole basis of this work, lad." And I could probably fill up another half an hour with examples of when Tom said things like that about where the work came from and what it was about. So I'll give you one example. The original trainings, we learned a coccyx procedure. And we got told that the coccyx procedure is this mysteriously wonderful, energetically powerful procedure. It can treat things from migraines, to reproductive problems, to bladder and kidney problems, to back problems, spine problems, neck problems. It didn't matter. This coccyx seemed to have this incredible potential to work in so many, or to influence so many places. And from a point of view of the chiropractic or osteopathic model, you can see, because it's the attachment point where the dura is anchored at the base of the spine, then that provides us with those 4 places. So it's attached at the coccyx and the sacroiliac joint, and then at the top end, it's attached at the cervical vertebrae and the cranial base. So you can imagine if there's a dysfunction at the coccyx, that pulls on the dura and it pulls and puts pressure on either the neck or the base of the skull. And, in Romney's words, when we are watching Tom working with the coccyx, he's telling us that he's using the coccyx work to reset the cranial rhythm. He's using it to influence the cranial bones, and it was a big part of his special clinics. And so he's using it, and we can see that there's a direct sort of neural and dural connection up through the spine. But it's also the governing vessel meridian of Chinese medicine. And if you start to look at that governing vessel, particularly its branches, then you start to come up with a dawning realization of how the kidney procedure works and what it's actually supposed to do, because it's actually sending the concept of kidney essence from Chinese medicine through the branches of the governing vessel channels up to the brain to nourish the essence that makes the brain function better and stuff like that. But the coccyx is the meeting point of no less than 6 meridians. So 6 meridians converge at this one point, and they are the kidney and the bladder. They are the conception vessel and the governing vessel, and they're a thing called the directing vessel or Chong meridian, which runs right. Those 3 of those meridians carry the essence of the body through, they're called extraordinary meridians, and they carry it through the uterus before it goes on to other places. So its capacity to impact fertility, and its capacity to impact fertility is not just because it can work on those meridians that supply the essence to the uterus and the qi and the blood to the uterus, but because as it follows up the spine and creates its shift at the sphenoid, you've got your pituitary gland tucked into the sella turcica at the other end of the governing vessel there, which will govern all the, influence the hormonal impacts. So as I started to look at the meridian connections to explain the work, it just got easier and easier and easier to understand how this technique was working. And I think, in a sense, all I'm doing is I discover these meridian links and so on and use them to explain how the procedures are working. All I'm really doing is reverse engineering the Bowen technique from its modern day form to what it used to be in the beginning.
I really love that, thank you. And it's interesting as you're talking about fertility and those links into the coccyx as well, when we think as well about how much more time people spend sitting these days, how much pressure is put in there, how badly people are sitting, how they're compressing their organs, how they're affecting their tissues, lymphatics not moving, all that scrunching through the inguinal ligaments and the quar points, and it's no wonder that we're having so many problems that relate to those areas in the body, really, wouldn't you say?
I think that's true. Modern lifestyles are very hard on the body, which is good, because then we get to run a busy practice and learn lots about treating people, and we get to educate our kids and buy some wine. It's the way the world works.
Yeah, we've got to remember that there's all those other parts to it as well, aren't there? So, yeah. I mean, I'm curious as well with this evolution over time and this experience. Is there anything that you kind of held on to for quite a long time as an idea and then were able to drop, and are there any things that have been really consistent in the theory that you've been working with? What are some of the kind of key learnings that you feel that you've got out of this process over the last 35 years?
I suppose the first key learning was, when I learned Bowen Technique, I went from 0 to being a Bowen therapist overnight. I remember Ozzy looked at me and he said, do you know any Bowen Technique? And I said, no. And he said, good. He said, I prefer it that way. And I basically learned intensely. I won't go into all that, but I learned very intensely. So that was the first learning curve. And then the second learning curve was when I started watching Romney and saw that he really didn't use very much of what I was using. The technique that he was using was quite different. And for example, he didn't do any pelvic procedure. He did the coccyx procedure very differently. And in his work, he really focused on those 4 places. So that information came back to me again as, yeah, that's what I've got to do. And so at that time, realizing that, as I said earlier, that the asymmetry that I was seeing in the body was a reflection of the nervous system imbalance, not of a pelvic imbalance. So I had to let that idea that I'd had for a long time go, but it was just an evolution. And it's not hard when the body is responding to your new information so much better. It's like when you find the gears in a car and you put it into first gear instead of fourth and try to take off, it goes a lot better. So you learn very quickly. It's not a hard thing to let go of that fourth gear. I think I've been so fortunate that I've had great mentors. So I feel like I've been in the right place just at the right time, that I've had great mentors, not just in the Bowen work, but also fantastic chiropractors, fantastic acupuncture and Chinese medicine practitioners who've been able to guide me and influence me. And in my early days, especially, I was just a sponge, just constantly soaking up information. So I don't feel like I've got a whole trail of I thought this and then I threw it away, and I thought this and then I threw that away. I think it's been an evolution where I was fortunate enough to have the right people influence me at the right time. I'd say my biggest skill was having that capacity to look to other people to teach me, to constantly pick the brain of other people, because I couldn't have learned it all without having those other people around me to explain and say, listen, don't do that. Read this book here, read this chapter. That's what you're looking for, and everything will be self-explained once you've done that. And, if I went looking for that chapter myself, I would have had to go and study osteopathy or chiropractic or something like that. So getting other people to help is a great way to go.
Yeah, I think that's a really key point for again, any of our kind of new and less experienced Bowen practitioners that are listening into this, is that there's a process involved over time, and it's only through that application of time and repeat experience and being around great teachers, having opportunity to hear all these perspectives, that we actually get to evolve the practice in a way that functions not just for the patients, but in the way that we think and we act, and that in itself is an evolution over time. So I'm kind of curious, with what you've seen over the last 35 years, what are your thoughts about how this is going to evolve over the next 10 years? How do you see your work evolving and changing and feeding into the kind of the greater scheme of health and public health?
Well, I think Bowen Technique is a great technique. I really think that it's got some wonderful attributes that allow us, when we work in clinic, to very safely create wonderful changes for people. And often, because of the holistic nature, certainly of the way I practice Bowen Technique, it allows me to work on areas that are not necessarily covered by the mainstream medical world. Most of my cases, especially when someone comes in with, for example, just yesterday, a new patient, swollen, inflamed knee, and one leg is like 2 inches shorter than the other leg, and I got her to grind her teeth together, and as she ground her teeth together, the leg lengths became equal. And showing a TMJ dysfunction was at the root of the nervous system stress, probably from the operation. She just had a knee replacement 3 weeks ago. So we did the TMJ work on her. It balanced everything up, and we said, come back next week. That's going to be heaps less inflamed. It's going to be heaps less painful, and you can continue. Once we get that right, you can go on with your rehab. There's nothing in the Western medical world that would allow that type of holistic vision. So I think we add something in terms of our holistic view. And for me, the evolution of my own work, I feel that the observations of symmetry have been well understood by those willing to accept it, and that it's available now and through a lot of schools. So there are schools of Bowen therapy out there now who actually incorporate that into their teachings. They think it's an essential component of the teachings to be able to do holistic assessment, and they find it valuable, so they've incorporated it. And I think that's great. I don't try to control that in any way. Just might put my book out there and put the information out there and hope people pick it up and use it. I'm hoping, for me, the next 10 years allows me to make a meaningful exploration of how Bowen Technique influences the meridian system. I think that's really the special parts, the miracle parts of Tom's work that we don't understand yet. I'm hoping that my wife and I, Kate, can write a book that will elucidate and illuminate the energetic aspects of the technique from a meridian perspective.
Wow, I can't wait for that. That's going to be great. You know, with my own kind of practice in qigong and the way that we use the 5 elements and the meridians in the kinesiology as well. So you know, that was one of the things I really enjoyed in your textbook of Bowen Technique, was that relationship into the meridians, because for me, reading it, having the understanding that I do of the meridian system, the depth that then added onto the Bowen work for me, which I'd already kind of been observing to a degree, but to actually see it laid out and written down as it was really really beautifully beneficial for me. And you know, I know that for a lot of people, they might not have looked at your training previously as well, and I'd love you to just give us a little bit of a taste of what gets covered in the Importance of Symmetry workshops, that as you say, and I think rightly so, that it's being taught in some of the other schools as well, if they're choosing to add that in. I think that's a really, really useful thing to teach people, because having it up front would make a real difference to how you practice. But you know, all roads lead to Bowen at some level. So you know, but again, if you could just share a little bit about the training, the Importance of Symmetry training, for people who might not have come across it.
Okay, thanks, Ben. For me, anything that I do, if I'm going to try and share it with someone, the key has to be simplicity. So what I wanted to do was reduce what I was trying to pass on to a very simple and holistic message. So the main part of it is that when the body experiences a dysfunction at one of those 4 sites, which are the common sites at which it does experience dysfunction, then this particular dysfunction will manifest itself globally within the body in the form of tonal asymmetry. So in other words, there'll be increased tension down one side of the body because of the body adapting to the stress that it's suddenly come in contact with. And from this basic principle, then, we can do some different types of screening, and different types of testing that allow us to try to quickly locate, for example, is that coming from the sacroiliac joint, or is that coming from the C2 and C3, or is that coming you know, from the cranial base or the jaw or something like that. So we've got some quick testings and screenings that we teach, which allow people to have a pre-test indicator of dysfunction, and now they can go and look for it and try and treat it. I must say, if I can hijack the question just a little bit. Bowen is learned as a system of treatment, for better or for worse. The problem is, Bowen is just as much a system of assessment. So with each move, as you move that tissue, you become informed. If you're listening to your fingers, if you're using them therapeutically and diagnostically, you can actually sense with your fingertips whether that tissue is normal or not. And so you can straight away tell, as soon as I touch a scalene muscle, for example, I can say, oh, that's not right, here's the problem. And then in my perception, that scalene muscle is attached up there to the transverse process of C2 and C3. So once I release that tension with a Bowen move, then C2 and C3 will go back to a normal functional state, back into a normal position and a normal movement. And I'll be able to come back 2 minutes later, check the move, and I'll be able to recognize with my fingers that that tissue has changed. So that's the basic principle of the iOS workshop. What I'm basically doing is saying, let's use a few tricks to see if we can spot where that problem's coming from. and we'll go up there and we'll palpate and we'll feel it's coming from here. You can put your finger on it really. And then we'll do our move, which is part of our procedure. You can do the whole procedure if you like. And then if you've identified correctly, you can recheck and now everything's balanced. So it's immediate feedback as to whether your treatment has hit the right place for what you're aiming at anyway. And then you can confidently send the patient out with the instruction to do this and that and come back next week, and we can repeat the process. So we teach in iOS, we teach the assessments, and we teach some background theory and principle. And most importantly, we demonstrate the procedures that are required to create change at those 4 places. So, for example, we have a series of moves or procedures that we will demonstrate throughout that workshop. And once they've been demonstrated, people get the chance to practice them and then come back. And they may be similar in some ways to their original Bowen training, but in some ways, those procedures will be different, which is why we're teaching them. So the person leaves armed with a whole new way of perceiving dysfunction. Most people, when they leave the workshop, are like, I want to call 10 of my patients and get them back on the table and have another look, because I have a different vision of dysfunction now, the different capacity to see it. And they've also got a whole new suite of moves and procedures that they can use to create the change. And that's it. It's 2 days. The iOS workshop originally was 2 days. I then created a second workshop, which was called Targeting Primary Dysfunction, which was another 2 days. But I think in the future, you'll see that that it's only a 3-day workshop that gets taught, which is just the 2 of them blended together, called iOS Extended. And in those, the only addition to that sort of extended workshop is a few extra screening procedures and a focus on developing that tactile recognition that guides your treatment, because that's the ultimate goal. The ultimate goal of therapy is for your fingers to become more and more intelligent, more and more informed, and have a greater sensitivity, a greater capacity to detect dysfunction and correct it.
Yeah, I think that's absolutely spot on, and I really agree with that. I think that one of the biggest skills we're really trying to develop in Bowen as we're practicing, or in any bodywork really, is that sensitivity, that feedback that allows us to, as you say, assess within that process of initiating a change within the tissue as well, and then being able to come back and observe that change within there. It really is, for me, one of the things that has only deepened and deepened over time as you spend more time with more people and you feel more examples. One of the things that I really enjoy doing, I'll go and work at events where I make kind of work with kind of 70, 80 people in a weekend, and having that level of practice come under your fingers, you get to see patterns in a very different way, because you need to stay really focused and observe what's taking place, because you don't really have time to be distracted and all over the place. So you get to learn that sensitivity, that acuity, and also within things like the Qigong, for me, that's part of the way that I train that throughout my whole body, so that we're developing that sensory awareness through like the fascia sinew channels, through the meridians, through the tissues themselves, and noticing what me as an individual is doing with my own version of that. And I also look at that as part of the information that we're exploring within Bowen as well. And again, through that idea of assessing as part of that reading of the tissue, not just performing the procedure, having 5 minutes, coming back to it, doing another procedure without actually being present in the process that you're involved in.
I think I couldn't agree with you more, Ben. That for me, what I love about Bowen the most is the journey that it's taken me on, how it's helped me to evolve as a therapist. I think the technique, my definition of Bowen would be that it's a technique for the perception and correction of neuromuscular dysfunction, biomechanical dysfunction, whatever. but the perception of it as well as the correction of it. And the move I was always taught it had 3 parts. It had assessment, treatment, and reassessment to see that you'd created the change, all built in simultaneously, depending on the situation as you did it. And then instead, many places started just teaching it as a series of moves. And you became a technician just applying a move. And people say to me, oh, I'm not even allowed to do the move twice. How could you tell if it changed or not? How could you get any feedback? So I understand that different schools can teach what they'd like to teach. That's fine with me, but it just concerns me that other people are not enjoying that growth process that comes from working on so many bodies and getting to know what's normal and what's not normal and what the normal movement patterns and movement signatures of those tissues are, and then going, oh, there's a problem here. Let me just get into it and I'll just find it. And there it is. And hang on. Oh, yes, that was a great move. And you come back and you check it 2 minutes later and you say, that's going to be fantastic. And not only that, I can see now that you're not showing me any irritation. It's been released. I can see that in the global presentation. I'm in control of the therapeutic input. I'm getting the results that I want. I can predict the therapeutic outcomes going forward, and I'm growing with every patient that I treat. And that's the absolute joy of Bowen therapy as a practitioner.
Yeah, I couldn't agree more. There's something so rewarding about being in that space and knowing that it's completely the relationship between what you're experiencing within that person, what they're presenting with, and then how you're perceiving it, the changes that you choose to make based on those observations. And I think it's a challenging thing as well, because we can only develop that eye over time. The difference between doing 10 hours, 100 hours, 1,000 hours, 10,000 hours. Yes. In some ways, I never would have guessed it, 21 years ago when my own kind of professional journey really kicked off, and just the changes that can take place over that time. So, yeah. So the next kind of direction I want to ask is, what do you wish somebody had taught you when you started that you think is essential now?
That's very, very easy. There are a lot of things, an awful lot of things. But to take a holistic view, when someone says take a holistic view, you kind of nod and say, yeah, but you don't even know what one is because you haven't seen it. And it's not until you get good at seeing some of this stuff, then you can recognize it and say, okay, I'm going to take a holistic view now, and you can create it. So I would take a holistic view, and I would see the spine or the nervous system or the person as one. So that's really important. If someone's complaining of sciatic pain or plantar fasciitis, it could be their jaw, it could be their neck. If someone's complaining of migraines, it could be their tailbone. The spine is one. And then the person is one beyond just the spine. So their issues you might recognize, although you're doing Bowen work on all the right places, it's not going to fix it because their problem isn't primarily spinal dysfunction. It's, their husband, or it's their job, or it's some other issues in their life. The wine that they keep drinking. So I wish one had explained to me. I wish that holistic view had to come right from day one. I was fortunate because through Chinese medicine, that came quite quickly, even though I didn't sort of recognize it for what it was. It was something that came quite quickly. The second thing that I wish I had was the assessments, because when you can look and say, wow, look at that degree of dysfunction, and then you can do some screening and you can say, oh, I know you're complaining about your knee, but it's actually coming from your neck, and I'm just going to go up there, find it and fix it. And initially people think you're crazy, and then after you fix them, you can never get rid of them as patients, nor their family. So I'd love to have those pre and post assessments more quickly. And then I don't have too many other things that I wish different, but you nailed it when you said it's all about the tactile experience based upon numbers of patients. I was so lucky that I had good mentors. The single most important thing to anybody who's trying to create a career in Bowen therapy is to have a good mentor. Someone you can swap treatments with, someone who'll keep checking that you're doing your moves the way they should be done, someone who'll keep giving you feedback, that really probably shouldn't be someone who you did the course with. I mean, it's nice to have friends, but it's someone who's already got heaps of experience, that's been doing it for 10 years and is has the capacity to mentor you. I was so lucky because I had Aussie and Romney, as such, I could constantly go and ask questions, and I could constantly refer to somebody, like ask somebody for advice. I think that's it. I think you've got to get lots of bodies to work on, lots of practice. You've got to have a really good mentor, and you need some capacity to conduct holistic assessment. They're the things that I'd say. Once you've got that, you're now unstoppable in terms of your progress, your growth. When you look back and you think, where was I 3 years ago? You're going to go, wow, I've come so far. And it doesn't matter where you are on the climb. It only matters that you've come so far. You're just enjoying that journey.
Yeah, I think that's absolutely spot on, Graham. Absolutely. And for me, this is also why within my work, I use an integral approach. So using the basis of Ken Wilbers' integral philosophy, looking at the subjective and objective parts of our reality as they appear in an individual and in its collective. So our mind, our body, its behavior, our relationships, culture, the environment. You can't separate us from any one aspect of those things. So at some level, they may have a role in, they do have a role, but whether or not it's constructive and supportive or not, it is the big question. And of course, those patients who think we're crazy, but when we change things and help them improve, they love us for it, but they still think we're crazy. So...
Yeah, I have no problem with my patients thinking I'm crazy. I'm comfortable with that. I'm also rational. So, we have a very busy practice, and, we put through about 130 patients a week, and there's no advertising or marketing to drive that. That's word of mouth. And it's basically very pragmatic. Okay, how about this? We did two treatments. I know you think I'm crazy. I'm going to treat your neck twice. If that hasn't fixed your knee, then you can tell everyone in town that I'm loony. All right, so off you go. Let's do it. And they, yeah, okay, that's a fair deal. And then they come back and they say, wow, I don't understand. And I say, of course you don't understand. You don't get paid to understand this.
It's so true, so true. But that's also one of the great things, isn't it? That's why, as you say, having mentors, being in any position where we can ask question of somebody who's got a different perspective to us. So our patients are coming to us because they need a view that they haven't worked out how to take for themselves, or they have an inkling of, and they don't know how to get any further than to come and find a person that, like yourself, like myself, like all of the wonderful therapists out there, and say, what's your perspective on what's going on here? How do you look at this in a way that can make a change for me?
Yeah, that's the reality. And, you're not going to have the answer for everybody, but for a lot of people, you should be able to provide that insight to start with that gives them some confidence. It's interesting. I don't think Tom didn't do very much more than, one-word answers for his patients. He sort of had a reputation, and that carried people into his rooms and let them, lie on the table. And Tom didn't say much to them and didn't offer much in the way of explanations, but he was able to perceive dysfunction and resolve dysfunction using his technique. And as long as I've always said, as long as you keep focusing on the quality of your work, getting better and better and better, your practice will get more and more successful. That's just the way it is. And if you're good at talking to people, and if you've got a lot of good other talents as well, then it's going to happen faster.
Yeah, absolutely. And of course, part of what we do, even though, as you say, not everybody gains an improvement, or although, in my experience, those are the few and the far between. It's not that that's a regular occurrence, but I think because of that holistic view that we're taking with people, and our ability to assess, to perceive, to listen to their story and how they managed to get themselves to where they did, often we can be useful in signposting people in the directions then that are going to support them, and all the other things that may work in synergy with Bowen as well to give that complete healing, that complete change they're looking for.
Yeah, absolutely. Absolutely. We still have other practitioners in our clinic, and we have other practitioners in the town, medical practitioners and others that we can refer to. And I think every patient needs a good team, and hopefully on their team they've got a good holistic practitioner that is a little bit crazy, but has some good insights that can be of benefit to them.
Yeah, I think that's a really important thing as well, and certainly for myself, again, that's part of my self-care, an acupuncturist, Bowen therapist, herbalist, people, talk therapist, people that can help me with those areas should they be needed. So, and then if we need to, we can go and see the doctors as well. But a lot of the time, if you're regulating yourself, then, the likelihood of the wheels coming off is a lot less. So one of the things I wanted to just come because we've been chatting now for kind of quite a good period of time, I was just curious, what do you think that we should be exploring in bodywork that you think isn't being given enough attention?
Well, I think my view there would be myopic, looking very much at how the work impacts the CNS. I'm very much of the view that philosophy that underpins chiropractic and osteopathy, which is the body is a self-regulating, holistic, interrelated entity that if we facilitate its function, then it will heal itself. So for me, it's very much about keeping our work holistic. And probably the thing that I look at in the industry that gives me most time to pause and be concerned is when there isn't a holistic, an underlying guidance to holistic practice, or when there isn't a holistic practice at all. It's one thing to say, oh, I'm being holistic because I treat the whole person, because I did some moves on his ankle and some moves on his knee and some moves on his neck. There's nothing holistic about that from my perspective. I want to know, why are you making a move? Why are you doing what you're doing? And can you do all of these whys because of your holistic perspective that you have? So I'd like to see more focus on a holistic approach, and that's my deepest concern. I've got, my son has started studying osteopathy, and his first subject, absolutely, they do block study. So they do one whole subject before they move on to the next whole subject, and then the next whole subject. So his first few weeks was the first introduction to evidence-based medicine. Now, I don't have an argument per se against you showing me good evidence for medical approaches and so forth. But what I do have is a big problem if you tell me that that's the only way that we should go, because I'm constantly seeing patients in my clinic where I'm treating a place that's quite remote to their symptomatology and getting a really good response clinically. But that's not how osteopaths and chiropractors are now being trained in Australia. They're being trained to treat the symptom area. And if they're not treating the symptom area, if they're doing a neck adjustment, for example, for a knee problem, then it's questionable whether their insurance will cover any damages that might arise to the patient. And as a consequence, evidence-based medicine doesn't just bring the advantages that it can, it brings the disadvantages of preventing those holistic approaches in a lot of the places. And so these days, I have a lot of chiropractors who, for example, take the iOS workshop and they say, I learned more about chiropractic philosophy in these 2 days than I did in my chiropractic course, simply because their school kept showing a deeper and deeper focus on evidence-based. Interestingly, here in Victoria, in Australia, the chiropractic school has just been closed. So it went deeper and deeper and deeper into evidence-based, and the committee of the university still shut it down and closed it off. So it didn't do itself any favors, and then it became extinct. So I've spoken to a lot of practitioners with more than 30 years experience, and this is their concern about current day educating as well. We as Bowen therapists have filled that void a little bit because we get to offer that holistic approach to our patients. It upsets me then in the teaching of Bowen therapy and other forms of body work when they don't encourage the holistic perspective as well as intelligent evidence-based inputs.
Yeah, I think that those are such good points as well, and it does concern me that in a number of services there seems this real narrowing of how things can be done, what's okay and what's not okay, and not seeing those relationships between different aspects of a person, and how those can affect things. Which again, why I'm so grateful, because of the Chinese medicine within the kinesiology, because of the nature of kinesiology, Bowen Technique, the integral approaches, they all bring together these ideas that you have to look at multiple areas. You can't just zero in on the one thing and expect that to be the everything.
I couldn't agree with you more, Ben. Even I often have to ask my patients now. I wear a number of hats. Which one did you come in to buy? Which one do you want me to put on? The acupuncture, the naturopath, the Bowen therapist? I do some counseling. Which hat should I put on? But actually, whichever hat you tell me to put on, I probably won't. I'll decide which hat I put on. But I just wanted to know which one you wanted before maybe I'll send you off in a different direction, either personally or to another therapist. We certainly don't have the answers to everybody.
Yeah, and I think that's a really, really important thing, and I see that a lot within my own clinic, that, when people come in, sometimes they don't know quite what it is they're looking for, so they've chosen a direction to get them started. And again, as you go through that initial assessment, which is right there as they're sat in the room before you even put your hands on, and you get all that background information that starts to then steer you in a direction that you think is going to be valuable for them, and engage them into that process and take them on that journey that comes out with them being different than how they were when they arrived.
Yeah, out of interest, do you know how Tom Bowen assessed people when he saw them? Well, he basically had three approaches. The first was he would just look at their jaw, and he'd look for the angle of their jaw, because from that he could glean what type of sacrococcygeal presentation he was going to be seeing when they got on the table, and therefore he knew what was happening in their spine from the bottom up to the top. He'd watch their gait or their walk as they went into a treatment room, and then of course he would just simply visually assess them on the table and use his fingers. So, but for him it started with a glance at the jaw, and that before he got into the treatment room, he already had ideas about what he was going to do with these people.
I think it's also really important to remember, and we've heard it in many guises before, that of course verbal language only makes up 10% or so of the communication. So much of it is non-verbal signaling. There's all sorts of things that are going on. So having the ability to be able to take that information that's there, as you say, in gait, in posture, in how somebody's holding themselves, there's so much that comes out before they've even spoken those first words yet, and again, that's part of what makes it beautiful, is seeing the transition between how somebody comes in and how they goes out.
Yeah, and just increasing your power of observation, increasing your ability to recognize what's happening. That's what it's all about, just getting better and better at seeing. That's the perception and correction of dysfunction.
Yeah, beautiful. Graham, thank you so much for speaking to us today. It's been great to be here representing the BTPA, and if people want to learn more about you and your work, where's the best place for us to send them to?
That's a very good question, Ben. I think there's a website which is www.bowenseminars.com.
.au. Yep, it's definitely, yeah, sure, because I have got it written down here because I did look it up before.
Yeah, in England, we have Robert and Matt who present the iOS and soon the iOS extended workshops. And I really don't do that much teaching these days. I do about one class a year in Australia, and I try to get over to the UK for a class once a year if I can. And that, yeah, but certainly Robert and Matt, they're out and about offering the iOS class. So yeah, on that website, which I'm sure you'll put on the screen or something, they can find a contact page. Yeah, there's a good theory page there as well. I think the theory page is worth a look.
It definitely is for anyone that's that interests in that, and yeah, we'll put the link in the video description afterwards. And I'm looking forward to the fact that Robert and Matt are going to be teaching the extended version soon. So I really enjoyed my training with Robert. It was great, and as well for anybody, they can always pick up your book as well. So that's available out there for people to have a look at. It's a great read as well. So my copy is well thumbed. It's definitely good to look into. So Graham, so grateful for your time today. We really appreciate it, and we'll look forward to hopefully seeing you in the UK again soon.
Good on you, Ben. It was great. Thank you.